Hi there, my name's Kirsten and I'm a dietetic intern at OSF St. Francis Medical Center. Today we're going to be discussing nutrition tips for taste alterations with chemotherapy. Cancer and cancer treatment such as chemotherapy, surgery, or radiation to the head or neck and some medicines can change the way foods taste. In fact, about 50% of patients receiving chemotherapy experience taste changes and it can just be downright frustrating. The patterns and intensity of taste changes vary considerably and may or may not get better with time. Most people report food tasting bitter and are able to tolerate sweeter or saltier food more than normal. Food dissatisfactions commonly reported are to meat, chocolate, fruit, and coffee. Patients will often describe food having a sawdust and or a metallic taste. And if food doesn't taste good to you, it can lead to weight loss, which can make you too weak to finish out your treatment. Taste changes may last for hours, days, weeks, or even months after chemotherapy, and the exact reason for the taste changes is unclear, although it is thought that it is a result of the damage to the cells of the oral cavity, as they are especially sensitive to chemotherapy. Today, I will offer practical solutions to alter flavor to make food more enjoyable so you can eat your best during and after treatment. To avoid metallic taste, try milder proteins such as turkey, eggs, Greek yogurt, fish, cottage cheese, nuts, or chicken. Use plastic or wooden utensils instead of metal for eating and cooking. And when cooking, avoid thin aluminum cookware, copper cookware, or cast iron pots because some of the metal can transfer to the food. Instead, use stainless steel or glass cookware. Marinate or soak meat in sweet sauces such as fruit juices, salad dressings, barbecue sauce, salsa, jellies, or sweet and sour sauce. Try adding tart or sour juices to dishes such as orange, lemon, or lime juices. For example, you could add vinegar, lemon juice, or pickles to creamy dressings for potatoes, tuna, macaroni, egg, or coleslaw salads. Avoid these if you have a sore mouth. Avoid canned foods because some of the aluminum might affect the taste of the food. Instead, choose fresh or frozen foods. To avoid bitter taste, peel vegetables before cooking or eating, as the peels can lead to a more dramatic bitter taste. Add some extra sugar or sweetness to the food, such as honey, syrup, or fruit to balance bitter taste. For example, sweet potatoes with maple syrup, apples with peanut butter, or use sweet dressings or salads for vegetables such as Thousand Island or honey mustard. To avoid strong or bad tasting foods, try mild tasting foods such as plain crackers, toast, dry cereals, mashed potatoes, milk, steamed rice, plain yogurt, plain noodles and butter, custard, pudding, cottage cheese, sherbet, and gelatin. Cook outdoors or buy pre-cooked foods or keep foods covered and allow others to cook for you to avoid displeasing smells. If foods taste bland, try marinating foods with teriyaki sauce, sweet and sour sauce, vinegar, lemon, lime, or orange juice, or use condiments at the table such as soy sauce, ketchup, mustard, barbecue sauce, or jelly. Use herbs such as basil, mint, rosemary, and parsley, and spices such as cinnamon, cumin, turmeric, allspice, or celery seed. Avoid spicy foods and use foods with strong flavors, such as onions and garlic. Try adding sauces and gravies to food to boost flavor, such as marinara sauce, Alfredo sauce, cheese sauce, chocolate sauce, or sausage gravy to add flavor. Consume sour-tasting foods, such as lemon and limes, as they can stimulate your taste buds and saliva flow. Try alternate bites of different tasting foods within a meal, such as cottage cheese and pineapple, canned fruit and plain yogurt, grilled cheese and tomato juice. Also, try these general tips to help manage taste changes. If a food doesn't taste good, try it again in a month. Eat cold or at room temperature because they may taste better and have less of a smell than hot foods. Practice good oral hygiene by regularly brushing your tongue and teeth. You could also try rinsing the mouth with a mixture of baking soda and water. If food tastes bland or has no flavor, attempt using strong flavors. In conclusion to these nutrition tips, remember to keep your doctor informed. Your body needs nutrition, especially when undergoing rigorous cancer treatment. If you find that changes in taste and smell are limiting your food intake or causing significant weight loss, be sure to let your doctor know. A dietitian can help you make changes in food choices and preparations to minimize the impact of taste changes and also assist you in meeting your calorie and protein needs. Your dietitian may recommend appetite stimulants or vitamins and/or supplements. If you can't eat solid foods, your dietitian may recommend liquid or powdered meal replacements and shakes. For more information, visit www.holthealthy.org and click on Cancer Programs for more information. I hope you're able to take a few tips from today's podcast and use them in the kitchen. Thanks for listening today and have a great day.